Hello everyone. In the previous session, I have started a topic. It's called role of herbs in cosmetic. And in the previous sessions, I have discussed the role of herbs in skincare, like turmeric and aloe vera. And I have discussed various benefits of aloe vera and turmeric if we use in various cosmetic product. Then in the last session, means in that second session, I have discussed the role of herbs in hair care. Okay, so in that session, I have discussed the benefits of amla and henna, these two herbs that I have discussed. So how it will give an advantage, or what are the benefits of amla and henna on the hair care. So now in this session, in my last session of this topic, role of herbs in cosmetics. So I am going to discuss the two herbs, that is neem and clove, and what are their benefits in oral care. Okay, so these are the two herbs that I'm going to discuss in today's session. The benefits or use of neem and clove in various cosmetic products. So let's start with the first one, that is neem. So neem tree, or the scientific name is an Azadirachta indica. So it belongs to the family Meliaceae. Now neem is a very common and widely used in herbs in various cosmetic products. Okay, not only uh, dental care or oral care, even it can be used for skin care also. Now, coming to that oral care, so neem dental care products, normally neem toothpaste also it is in very much used nowadays. So those dental care products, mainly it contains the neem leaves and bark extract. So the leaf and bark extract of neem is mainly used in various dental care or oral care products. Now, neem leaf is rich in antioxidants. Okay, so the neem leaf having antioxidants activity, and also it helps to boost the immune response in gum and tissues in the mouth. Okay, so gum and tissues, it will give a good immune response. Suppose if any microbes it will attack on the gums and tissues in the mouth, so uh, there will be a good immune response in gums and tissues if we use neem, or you can say the dental care products having neem. Okay, so neem leaves, it is having antioxidant properties, and it will help in boosting the immune response in gums and tissues. Now neem offers a good remedy for curing mouth ulcer, tooth decay, and act as a pain reliever in toothache. So if any person having tooth pain, or suppose damage in that tooth enamel, that is called the tooth decay. Tooth decay, you know that mainly it is damage to the surface of the teeth, mainly the enamel part. You know that the surface of the teeth is called enamel. Okay, so if the enamel is get damaged, that is called the tooth decays. Okay, or any person uh, having that mouth ulcer problem. Okay, so neem is in good remedies for the mouth ulcer, a tooth decays, and also act as an pain reliever in tooth pain. Now, what is the role of neem in oral care? So there is an four or five advantages, or four or five benefits are there of neem. Okay, so the first one is an antibacterial activities. Okay, so neem is a very natural antibacterial agents. So the antibacterial effects of neem it has been reported against some bacteria like Streptococcus mutans and Streptococcus faecalis. So these are the two uh, bacteria against whom neem will act as an antibacterial agent. Okay, now the ethanolic extract. So if we'll make an extract, okay, ethanolic extract of neem leaves and neem bark, so that will give a very good antibacterial activity. Okay, so how we can use the neem in various dental care or oral care products? So just you have to take the extract form, ethanolic extract of neem leaves or neem bark. Okay, so that extract if we use in various dental care or oral care product, so that can be act as an antibacterial activities. Okay, even just a dry chewing of the sticks. So normally I think you have seen that some people's they are uh, directly chewing that neem sticks. Okay, so that also it will give a very good antibacterial activity against streptococcus mutans. Okay, so the extract is very good. The ethanolic extract we can use in various oral care product, and even the very simple way, even if any person will just chew the dry sticks of neem, that also give a very good antibacterial activities. Now the second one is anti-candidal activity. So what is anti-candidal activity? So it is coming from the word is called that candidiasis. So candidiasis is an fungal infection. Okay, so not only the antibacterials, the neem can be act as an antifungal activity also. Okay, so the ethanolic or aqueous extract, not only ethanolic, the aqueous extract of neem leaf, it also show a very good anti-candidal effect against the candida albicans. Okay, so one study has been made and it's found that the effect of that leaf aqueous extract, it will be effect against the adhesion, the self surface hydrophobicity and biofilm formation, which may affect the colonization of candida albicans. Okay, colonization means when this microbes they will uh, made colonies. Okay, so that will get inhibit by using neem. So how they will affect? So their effect directly on the adhesion means the microbes they can't adhere or attach to the surface. Okay, so it will directly affect the neem, it will directly affect on the adhesion, on the cell surface hydrophobicity and the biofilm formation. Biofilm formation means when collectively when suppose and two or three microbes they will growth in different surfaces. Okay, so collectively we can call it as biofilm formation. So this biofilm formation and addition to that surface, so that will be inhibited by neem. Okay, so when this growth will be not there, so definitely the colonies will not form. So this neem extract, ethanolic extract or aqueous extract, it will be very much effective against the Candida albicans. Okay. Now, third one is an anti-karyogenic activity. Okay, so we have discussed about the ethanolic extract, we discussed about the aqueous extract. Now, next the chloroform extract. The chloroform extract of neem leaves, it is inhibited the Streptococcus mutans and Streptococcus salivarius and provides an aid for treating the dental caries. Okay, so the dental caries, it will be inhibited by using and chloroform extract of neem leaves. So it will effective against certain bacteria like streptococcus mutans and streptococcus salivarius. Okay, so against those bacteria it will works, and those bacteria actually it will cause dental caries. Okay, so those bacteria causes dental caries, and the neem extract, the chloroform extract, whenever you use in various uh, cosmetics product, means that dental products, so those can be act against those particular bacteria. Now the toothpaste containing neem as well as its fluoridated toothpaste as equally effective against the bacteria. So it will be very much effective against bacteria. Now acetone extract from the bark of neem is an bactericidal. It act against the bacteria, okay, streptococcus sobrinus. So it will be also act as an anti-carcinogenic activity. Okay, so an anti-carcinogenic activity means it will act against certain bacteria, those bacteria which mainly promote the dental caries, which is mainly responsible for the dental caries. Okay, so against those bacteria which mainly promote the dental caries, those bacteria effect can be inhibited, or the dental caries can be inhibited by using neem. Okay, if we use a chloroform extract of neem leaves in the dental care products, so that can be effective against those bacteria. So it can be act as an anti-carcinogenic activity. Next, it can be also act as an anti-plaque. Okay, so dental plaque is a very a common problem for so many people. Okay, dental plaque. So it can be act also as an anti-plaque activity. Okay, so one of the examples like mucoadhesive dental gel. Okay, not only paste. So there are some gel is there, mucoadhesive. So mucoadhesive means some type of dosage form, where the drug or the total dosage form, it will stick onto the mucus layer. Okay, you know that our internal cavity, our cavity internal part, suppose mouth internal part is, if you touch, it will be very slippery. Okay, even various body cavities, even our nasal root, even suppose stomach. Okay, even various body cavities, the inner layer, it is having slippery, it is called as a mucus layer or mucosal surface. So some dosage form, whenever you prepare, if you place on that particular cavities, so those dosage form, it can attach with the mucosal layer. Okay, it will be completely attached with the mucosal layer. Suppose the mouth cavity is there, the inner part of the mouth cavity. So the gel, whenever you apply the gel, it will stick onto the mucosal layer, and the drug or that active constituent, it will be directly affecting on that local surface. Even it can be effective in the systemic circulation also, because through the mucus layer it can go to the systemic circulation. Okay, so one of the example here is a mucoadhesive dental gel. So the gel which is containing neem is found to be effective by reducing the plaque index and salivary bacterial count. Okay, so it will very much benefit against the plaque. Okay, so this is about the neem. So next one is the clove. Okay, so same like neem also, the clove or clove oil having very much benefits in dental care or oral care. So the clove oil, it is extracted from clove tree, and it is in steam distilled from the clove buds. I think you are very much familiar about the clove. Okay, clove buds. So this clove oil, it will be extracted from the clove tree. Mainly, it is in steam distilled from the clove buds. Okay, that clove also, you know, that is in very much smell. It is there for the pungent or very much intense smell. Okay, so this clove oil, it is having an antioxidant activity and antimicrobial activity, antifungal activity, anti-inflammatory activity, and anesthetic property also. Okay, antioxidant, antimicrobial against different microbes, against different fungi, then antifungal, anti-inflammatory. Suppose any person having some burning sensation. Okay, so in that case also, it act as an anti-inflammatory. Suppose any person having, suppose mouth ulcer, okay, or suppose inflammation in the oral cavity, so in that case also it is effective as an anti-inflammatory. And suppose any person having very much tooth pain, so to get relief of that pain or giving a very calm effect, so uh, the clove can be used as an anesthetic properties. Okay, or it is given very sedative effect, very calm effect. Okay, so now clove oil contains an active ingredients. It's called the eugenol. Okay, so which is a natural anesthetics. Okay, so remember this thing, term that is called the eugenol. It is the main active constituent, okay, in clove oil. Okay, now it helps because it then works as an anesthetic, so it helps in numbs and reduce the pain to ease the toothache. So if any person having very much tooth pain, so to give a very calm effect or give a comfortable effect, so it can be used as an anesthetic, okay, or sedative effect. So and it may help prevent the cavities and relieve the oral pain. And traditionally it is used to relieve the toothache. Already I said it is very much relief for from tooth pain. And it also used in mouth and throat inflammation. Already I said that if any person having inflammation, or suppose any else mouth ulcer or any inflammation in the mouth, so in that case also it can be used because the clove oil having an anti-inflammatory activity. Okay, is also used for various gum disease also disorder. As we know that gingivitis and periodontitis, so this is one type of inflammation, itis. Okay, so gingivitis and periodontitis. Okay, so these two is an inflammation or mainly the disorder in the gums. Okay, so clove oil can be effective against those problem also. Now, what are the benefits of clove oil in oral care? So already I said, so just some few points in that. So it is reported as uh, very much used in the toothpaste and mouthwash, as it is a very much uh, effective against microbes and fungal infection, or even given very calm effect, okay, anesthetic effect, antioxidants effect. So because of that, it is so much used in various toothpaste and mouthwashes. And already I said that because of the eugenol, so eugenol having an anesthetic property, so it will give a very sedative effect. So it will give a sedative effect or anesthetic effect if any person is having some toothache or tooth pain. Okay, so eugenol and aromatic oily liquid extracted from clove oil is used as an sedative in dental procedures. Then it also has an anti-plaque properties also. Okay, so it may inhibit the growth of oral bacteria that may cause dental plaque. Okay, so if any dental plaque causing bacteria, okay, so the clove also it can be used to inhibit the growth of those bacteria, and it also act as an anti-plaque properties, anti-plaque agents. And the clove oil it also found to exhibit the anti-cariogenic activity and cytotoxic activity. Okay, so it also act against the dental caries. Okay, it also act dental caries, as we know that it is having an antimicrobial activities or antibacterial activities, so definitely it will works against those bacteria which will cause dental caries. Okay, so it is found to exhibit anti-carcinogenic, or you can say that it will act against those bacteria which causes dental caries. And it also act as an cytotoxic activity. Okay, so cytotoxic activity means toxic to the cell. Okay, so it is also having those cytotoxic activity against a large number of oral pathogens. Okay, so against oral pathogen it also act as an, it exhibit or act as a cytotoxic activity. And eugenols and eugenyl acetate, so those are the two components which is present in the clove oil. It also prevent the decalcification and dental erosion. So decalcification means when there is an loss of calcium. Okay, there is a loss of calcium. And dental erosion means when the enamel part or the teeth has been damaged, okay, or erode. So this is the dental erosion. Okay, normally it is by food, or you know that food is having acids, Okay, so because of those particular food ingredients, so the tooth can be damaged. So it's called the dental erosion. Okay, so this eugenol and eugenol acetate, the two components which is present in the clove oil, it also prevent the loss of calcium. It means it's prevent the decalcification and prevent the dental erosions. Okay, and it also acts as an against microorganism which causes dental caries. Already I said. And next, the clove oil is also stimulates the circulation due to its hot nature. As clove is in hot nature, it promote the very good circulation in the mouth or in the teeth. Okay, so which increase or enhance the gum tissue health when there is more circulations. So because of that, it enhance to improve the gum tissues health. It also act to remove the bad breath. Okay, so which is mainly caused by an bacteria. Okay, so normally no, the bacteria normally if will take the food, if will not clean properly, and then there will be bacterial growth. Okay, and because of that bacterial growth, there will be bad breath will come, or bad smell, or bad odor. Okay, so the clove oil, it can work against against those bacteria, or it is act as an antibacterial agent, so which is mainly used to inhibit the bad breath or bad odor. That's why the clove, it can be used in mouthwash also. Okay, it can be used in mouthwash. And it is also help to remineralize the teeth due to the protective properties of eugenol against the acids. So after taking the food, the acid attack is there. So in those cases also, it also help to remineralize. Okay, the mineral will come again, so remineralize the teeth. Okay, so due to the protective properties of eugenol, so eugenol having the protective properties. Okay, so it will protect the teeth from loss of minerals. So it will help in remineralize the teeth due to the protective nature of eugenol against the acid. So against the acid, it will protect the teeth and remineralize it. Okay, so these are the benefits of clove. Okay, so in this session we have discussed neem and clove, its benefits on oral care. Okay, so it's mainly it is those having antibacterial activity, because in our mouth there is a more chance of bacterial growth. Okay, because of the food. Okay, so neem and clove, it act against various bacterial attack. Okay, it is also act as an anti-inflammatory activity in case of clove. Okay, it is having antioxidant activity. So those are the benefits of neem and clove, which is act on various, which is used in various oral care products like toothpaste and mouthwash. Okay, so that's it about the various roles of herbs in cosmetics. So we have discussed the uh, use of turmeric and aloe vera in skincare, and next we have discussed the use or benefits of amla and henna in hair care, and in this session we have discussed the benefits of neem and clove oil in oral care. So that's it about the topic role of herbs in cosmetics. Thank you.